All right, so today we're going to tackle clin reasoning. So this exam is tomorrow. And what I've done so far, I do have some Ankis that I created in class. I have done my notes for 3 of these PowerPoints. Kind of a combination I'll show you here. Some of these work really well into these matrices. So for vitamins A, C, and E, I kind of have these 3 columns here. So I'll show you how we can study that pretty effectively. That's actually pretty much the entire PowerPoint. There's probably a couple of questions that'll be pulled from the slides before we really got into those. The second PowerPoint is all about B vitamins. So these fit really, really nicely into this matrix here. And then we will go to vitamin D, which we have some kind of Feynman technique notes here. Into kind of some hybrid stuff, vitamin D deficiency problems, some screening info, treatment options, and then some cases. So kind of a hybrid there. And then I don't actually have anything for this yet, except for having watched the lecture. All right, so how do we tackle this? So I've already created some Anki in class. I might as well just knock those out first and then just kind of see what I was missing and kind of supplement that. So let's just do that. Let's just get that out of the way. So vitamin deficiencies, we have 20 cards. Let's knock these out real quick. All right, reduced vibratory sense, reduced proprioception are indicative of which vitamin deficiency. Okay, so this is a PowerPoint that's on. You're definitely going to get this with B12 as well, but this PowerPoint isn't on B12. It's on A, C, and E. Let me think about this for a second. So A is all about night blindness, right? That's kind of the big one there. That's your beta carotenes. C is kind of all about bones and calcium and such, right? Vitamin C. E is going to be the one that I think has a lot of neurological issues with it. So I'm going to go E here. It is E. Okay. Connect my controller here. All right, poor wound healing and pseudoparalysis can be presentations for deficiency of what vitamin? Yeah, this is a big one. So wound healing. There's a couple different things here with like platelets. Doesn't vitamin E also make you bleed? I'm going to say E here as well. It's C. Okay. So let's see where I have that in the matrix here. This is really not the best way to study. I just want to knock these out. So C, you're going to have, yep, poor wound healing and bleeding right there. So deficiency, that's the important thing. Toxicity of E is what's going to cause hemorrhagic stroke and more bleeding. Too many vitamin E's make you bleed. That's a really, really important thing there. C is going to be the opposite. You need vitamin C to be able to like coagulate properly. So if you have a deficiency in C, then that's where you're going to get that poor wound healing and bleeding. So that's a really important thing to note there. Inhibits free radical formation. I think this is C and E, but I'm going to go E on this one because C may reduce, yeah, for most free radicals. C and E both do that. So I'm going to say, I'm going to make an edit there. We'll take that. 3 forms of vitamin A. Blank is the predominant form of vitamin A, beta carotene. Is it retinol? Yeah, we'll take that. I think these are all the retinoids. B and C are blank soluble, non-toxic, even in high doses. So ADEC are going to be fat soluble, right? So these are going to be water soluble. It's going to be a vitamin A deficiency. Whether breast or bottle-fed vitamin blank supplementation is recommended for all infants. Oh, that's a great. So I actually think this is vitamin D. Yeah, this was just mentioned in the slides before the ACE. Vitamin E has this effect on platelets. Well, too many are going to make you bleed, right? So too many are going to nuke your platelets. So vitamin E, but I feel like, yeah, vitamin E itself is going to like weaken them, reduce them, inhibit their adhesion. Okay, yeah, we'll take that because too many of those means we're gonna bleed, we're gonna have a hemorrhagic stroke. Blank is the most serious toxic effect of vitamin A toxicity. Oh, that's a great question. Too much of this. I don't know, like sepsis or something. Intracranial hypertension. Okay. Yeah, that's a big one. We'll see that here. Most serious toxic high. Is sepsis anywhere in this entire document? No. I'm spelling sepsis right. Yeah. Okay. That's a good one to know. Severe ataxia. Um, More neurological stuff is going to be on the E side, isn't it? Yeah. I actually thought I put a brain over here. I did not. Yeah, this really should be blood/brain, honestly. Vitamin blank converts folic acid B9 to its active form. Yeah, that's a great question. Is this A? No, it's C. Okay. Yeah, that's good to know. Why do vitamin C deficient patients have bleeding gums? Because we need vitamin C to we need vitamin C for like coagulation factors. So not exactly. It's defective dentin formation leads to hemorrhaging into gum. So it's more of the bone weakness we're gonna get there. So it's the collagen issue. And I guess it's because there's no bone, it just gets down to like the vasculature. That's here, yeah, defective dentin formation. So not really like a platelet or coagulation factor issue. It's there. Okay. Xerophthalmia or the inability to produce tears can be from the deficiency of what vitamin? Is this E? It's A. Okay. Serum alpha tocopherol measures which vitamin? Is it E? Yeah. Okay. Vitamin C deficient state known as is this just rickets? Oh, scurvy. Ricket. What is rickets? Is that D? Yeah. Whoops. Scurvy. We'll take that. Vitamin C's most important function is the formation of collagen, facilitates new bone growth. Vitamin A is highly blank teratogenic if given in excess doses. Teratogenic. Could you put like an A in that? I don't know if that's going to end up shooting me in the foot or not because there's an E in there too. But you got to put the emphasis on the A. Teratogenic. It's going to be A. Does the FDA analyze the content of dietary supplements? No. Three forms of vitamin A. Retinol is the predominant form. Provitamin A is going to be that beta carotene. And then the third one is, I have no idea. Carotenoids. Sure. Poor wound healing and pseudoparalysis can be presentation for deficiency of what vitamin? Poor wound healing. All right. Deficiency of this is going to be C. Vitamin blank converts folic acid B9 to its active form. That's going to be C as well. Maybe C for converts. I mean, I know that's not. It's like a little mnemonic there. I don't know. Not sure if that's going to work, but we got that. Is the most serious toxic effect of vitamin A deficiency? So that's going to be the left. What is there? That's intracranial hypertension, right? Very important that you remember hyper. Why do vitamin C deficient patients have bleeding gums? Poor dentin formation. Xerophthalmia, the ability to produce tears can be from deficiency in what vitamin? Is this A? Yeah. Where is that over here? Xerophthalmia, no tears. Make that purple. Three forms of vitamin A. It's almost like A, B, C, even though retinols aren't A, but it's retinols is A. It's like our big one. Beta carotene, and then C is going to be oh, my do not disturb. Oh, maybe that'll do a work focus. My mom calls. Okay. Three forms of vitamin A. This is going to be carotenoids, reduce vibratory sense, reduce proprioception, or this is going to be, should be E. Yeah. Three forms of vitamin A. Predominant form is retinol. Vitamin E has this effect on platelets. Vitamin E, so too many will make us bleed. So it's going to inhibit their adhesion. Number one cause of preventable blindness in children worldwide, vitamin A deficiency. Inhibits free radical formation. That's going to be C and E. B and C are water soluble. Whether breast or bottle fed vitamin D supplementation, all infants. I think it's, is it, I don't know the timing on that. We'll have to look that up. Poor wound healing and pseudoparalysis can present for different, all right, poor deficiency of this vitamin causes poor wound healing. That's going to be C. Vitamin C deficient state known as scurvy, scurvy. Blank has a most serious toxic vitamin A. That's going to be intracranial hypertension. Does the FDA analyze the content? No. Vitamin A is highly teratogenic. Severe ataxia. That's going to be over on the E side. Xerophthalmia that produce tears. That's going to be A. Three forms of vitamin A. What's the provitamin A? This is the big one, beta carotenes. Vitamin blank converts folic acid, converts folic C. Serum alpha tocopherol measures which vitamin? Isn't that E? How are we going to remember that? Tocopherol. Why do vitamin C deficient? That's going to be the dentin formation. Vitamin C's most important function is the formation of collagen, facilitating bone growth. All right, so the next learning card will come. So before we get into vitamin D, okay, so here's what we're going to do. So we're going to create new Ankis for this deck. Whatever. Vitamins. Here's what we're going to do. So anything that I thought was important in this section, we're going to make sure we throw in there. This looks important, so we'll throw this in there. Exclusively breastfeed for how many months? For 6, and continuous breastfeeding up to 2 years. Yeah, that's pretty crazy. We're going to do the same card for that so we know both of those times. 6 months, 2 years. Good. Some high-risk groups, vegans, fat dieters, alcoholics. Most toxic of all vitamins are those that are iron-containing. Vitamin, like supplements. Yeah, it's important. So we'll throw that in there. I have mud piles is, so you'll see a metabolic anion. Got, yeah, mud piles is that upper right. That's going to be metabolic acidosis, metabolic anion gap acidosis. Actually, let's do this. this is just to that's just hiding context. Don't have to guess. But I do want to know that, and we'll put that in as 2. All right, important. Okay, so now we're right into the matrix here. So we're going to utilize spatial memory to easily tell the difference. A matrix of 3 is really, really nice for this because you can just feel middle, feel left, and feel right in your mind. It just works so incredibly well. We do want to make sure we get the best resolution on this. So we're going to zoom in. The other thing too, before we do that, is we can go through and see, can we add any context? This is cystic fibrosis A and E. You could say like childhood respiratory condition. This stuff too, eye condition. Got the curvy scurvy. Most important, the formation of collagen, C for collagen, removes free radicals, C and E. Yeah, hyperthyroid patients, this kind of stood out to me. Diabetics, dialysis. Oops, this is vitamin E. Forgot to change that. This seems important. Um, vascular issue. Make this purple. It seems important. That seems important. Yeah, so we have intracranial hypertension on the left, hemorrhagic stroke on the right. Okay, good. So we have this. Zoom out just a bit. Or if it will capture me on this screenshot. Let's find out. All right, we'll go over to Anki. We'll pop this in. Yeah, there's my stupid face. So let's get rid of that. Take that again. All right. Yeah, I mean, honestly, this is probably the most powerful thing I've discovered in PA school. I could put all this stuff in flashcards, right? However, they're just living in the ether, in the nebulose, right? Putting those flashcards, like putting that context that I just did in some of these that I'm about to image occlude, it's putting them spatially in a location. So not only am I individually memorizing, that vitamin A is teratogenic or that at-risk groups are immigrants from Southeast Asia, sub-Saharan Africa, which I would know that from studying a flashcard as well, but I'm placing it on the left of this table, right? I know it's on the left. So if I see a question that says, immigrants from Southeast Asia, I know it's not C. I know it's not E. It's pushing my mind over towards the left. It works so incredibly well. This is why I study almost exclusively in this fashion. Okay. I know these are A, C, and E. However, I always like to occlude the headings just to really reaffirm. I mean, if you forget what the headings are, you're kind of screwed, right? So I already kind of know these, but we'll make sure we know retinols are the predominant one. Number one cause of preventable blindness in children. That's going to be important. Blindness as a bat, we want to make sure we don't give ourselves that one. But it's important, but can be, teratogenic. And again, we'll cover this here. Only in high doses. I think that's an important thing to note with that. I think knowing the two locations for this are important. We'll throw cystic fibrosis in there as well, and we'll link it to this. Yes. Yeah, I mean, IBD, malabsorption is that's for ADEC, so that's going to be kind of obvious, right? Children can only store several weeks worth. I think that's important. Eat orange things to maintain your levels. 5 daily servings. That's probably important. Night blindness. These are for deficiencies. I think this one is important. Male infertility, that kind of stands out. Yeah, so I think the toxicity, I think knowing this is important. It's not easy to become vitamin A toxic. You need 10 times the recommended dietary amount for several months. So the number 10 isn't important, but just knowing that's a high number, I think is important. This is going to be huge. If somebody's completely orange from overdosing, I think knowing that that's benign is important. All right, let's move on to C. Deficient, you got the curvy scurvy, matey. Most important formation of collagen. It's a reducing agent. I could see that being a question. Although reducing and antioxidant, I think are kind of the same thing. And I think that's why both of these remove free radicals. Whatever. Yep. So we're going to say removes free radicals here and there. Link those together. Helps metabolize tyrosine and cholesterol. Yeah, converts. This is important. Babies fed only cow's milk at risk. Fat dieters, this is important. Hyperthyroid, diabetics, dialysis, poor wound healing and bleeding. Arlo, come on in, bud. C for clot. So vitamin C helps our clotting factors. I don't know that that's the case, but in absence of that, it's going to cause bleeding and poor wound healing. Growth plate fractures. Yeah, definitely want to make sure we know this is important for bones. I mean, collagen we already put in there. This is going to be important. Pseudoparalysis, disappearance on X-ray. All right, that looks pretty good for C. Let's move on to E. I do want to know it's called tocopherol. That's going to be important. Atherosclerosis, reducing that, enhancing the immune response. I think that's really important as well. Inhibits platelet adhesion. That's going to be important. This kind of stood out too, this cholestatic liver disease. So we'll throw that in there. Isolated vitamin E deficiency syndrome is a thing, a rare genetic disorder. Yeah, this responds dramatically seemed to be important with this severe ataxia. So we'll throw that in there. We'll link those. Yeah, so there's these kind of three deficiency presentation. I think they could throw that in there. So we're going to throw like, okay, you get these kind of non-specific neuro symptoms up first. That's in the early. Progressive is where you're going to start to get ataxia. And then, yeah, this can't gaze upward is an interesting thing. I guess it's a cranial nerve 3 issue. And then end stage, yeah, getting dementia with a vitamin E deficiency. That's pretty crazy. Dysphagia as well. I mean, you definitely don't want that. You don't want swallowing airway issues. Low serum confirms diagnosis. Vitamin E, yeah, it can cause heart failure. That's pretty important. Easy bruising and bleeding. So toxicity, big one there. I need to make sure these all have to do with toxicity. It's a very easy thing to confuse here while studying. Increased risk for, we'll include all of this. Okay. That looks pretty good. So we're going to make sure we hide one guess one so that we can make connections. 39 cards added. That's really not bad. That's that entire PowerPoint. Let's let's lock this in first so that I can have all this in one, and then we'll add in the other PowerPoint. All right, so we should be able to get through this pretty efficiently. So we're going to go right into this and knock these out. We'll full screen so I can see from me up there, whatever. Okay, so let's hop right into it here. Be interrupted about 5 minutes. Okay. Toxicity risks of vitamin A. Blank is the most serious toxic effect. Intracranial hypertension. That's night blindness. A deficiency. Are there toxic? Yeah, okay. Really no toxicity issues with C, which makes sense because it's water soluble. Making connections. Converts blank acid to its active form, folic. Kids can only store several weeks worth. What is occluded here? Oh, inhibits blank adhesion, platelet adhesion. So causes bleeding. A deficiency causes bleeding, right? No, a toxicity. Yes, vitamin E itself inhibits platelet adhesion, so you don't want too much of it. Causing malabsorption resulting in severe blank, which responds, severe ataxia, which responds dramatically. That early presentation of vitamin E deficiency is going to be decreased vibration, decreased proprioception, growth plate fractures, blank to subperiosteal hemorrhage. Yeah, what is this? Pseudoparalysis. Tocopherol. Blank RDA for several months. Yeah, 10 times. So it takes a long time to get vitamin A toxicity. Most important, the formation of. Okay, we're back. I'll change the location here. All right, we're back to vitamin C, and most important, the formation of, we had said collagen. Three forms of vitamin A, beta carotene. The third one is going to be C. It starts with a C. It's like carotenoids or something. Yeah. Vitamin C due to subperiosteal hemorrhage. Yeah, what was this? Periosteum, the bone hemorrhage, pseudoparalysis. Yeah, it's such a weird term. Children can only store several weeks worth of vitamin A. So if you're going to have signs of deficiency like this, night blindness, it'll take weeks for kids, but a year for adults. So it's important. Vitamin E resulting in severe blank. Yeah, so this is that isolated deficiency. You're going to get that ataxia, which is more in this progressive area, but it sounds like this is more acute. Oh, this is actually a genetic disorder, but it's going to respond aggressively, substantially, dramatically. There we go to replacement. I shouldn't have put the K there. It looks like vitamin K. Night blindness, aka tocopherol or something. Inhibits blank adhesion, platelet adhesion for vitamin E, converts folic acid, that's vitamin C, is the most serious toxic effect. Intracranial hypertension deficiency. So these early onset deficiencies of vitamin E are going to be that decreased proprioception, vibratory sense. We have toxicity risk. Yeah, 10 times. So it takes several months, 10 times. So it's not easy to get vitamin A toxicity. Vitamin E toxicity. Too much of this is going to be easy bleeding or bruising. Vitamin C and E, I would say, are like these reducing agents. If it's a question, I'm going to say C. Babies fed only cow's milk. So you're not going to get that natural vitamin C, I guess, from breastfeeding. It's actually recommended to exclusively breastfeed for 6 months with continuous breastfeeding up to 2 years with other stuff. Removes blank. Vitamin C removes free radicals. So does E. It's just vitamin E. Enhancing blank the immune response. So yeah, so vitamin E is good for that immune E response and increased risk for vitamin E toxicity just in general. Oh, this is that hemorrhagic stroke. This is toxicity of E, too much of that, which makes sense. It's going to make you bleed when you have too much. Carotenemia, this Oompa Loompa syndrome, which I called it, is quite alarming but benign. Poor wound healing and bleeding. So C for clot is going to help you clot. So deficiency in that will make you bleed. Cystic fibrosis. We have this liver disease. Oh, it's like a weird name. Fibrotic, maybe? Cholestatic. Okay. Pregnant and lactating women. Hyperthyroidism patients. So hyperthyroid patients are at risk for vitamin C deficiency. Vitamin toxicity, the most toxic of all. The most, I wonder if that's like a no. Most toxic of all. Yeah, would that be like a calcitonin issue maybe is related to that? Most toxic of all vitamin supplements are those that are iron containing. The blank. Oh, so you'll see a metabolic anion. Okay. Truncal and limb ataxia. So you can't gaze upward. These progressive vitamin E deficiency, vitamin C, dysphagia, dementia, end stage vitamin E deficiency is going to give you that dementia. Male infertility for vitamin A, xerophthalmia can cause heart failure. So again, too much vitamin E, heart failure and bleeding slash hemorrhagic stroke. There are 3 forms of vitamin A. The first one is retinol, vitamin A, and blank ground glass appearance for a vitamin C deficiency. Immigrants from Sub-Saharan Africa and Southeast Asia? Southeast Asia. So like Philippines, Thailand, that type of thing. Indonesia may reduce incidence of atherosclerosis. So yeah, so vitamin E is going to be good, but you don't want too much of it because it will kill you. Deficiency, you got the scurvy curvy. Vitamin A's, I don't know why that pirate was from Ireland. Vitamin A is important for embryonic development, but can be teratogenic in excessive doses maternally, right? Vitamin E toxicity. So again, that heart failure, that bleeding, that hemorrhagic stroke, blank childhood respiratory. So we're going to have cystic fibrosis are risk factors for deficiencies in A and E. Eat orange things to maintain your levels. You want 5 daily servings of who is eating 5 daily servings of who eats 5 daily servings of anything other than like sugar? Vitamin A deficiency is the number one cause of preventable blindness in children. Blind as a bat. The eye of mud piles is isoniazid and iron hunting. So you'll see a metabolic anion gap acidosis. Growth plate due to subparalysis. So pseudoparalysis with C there. So right, let's keep that in the center and you'll get that one right. Blank liver disease. Cholestatic liver disease over there with E. Removes free radicals, C and E. Most important, the formation of collagen. Babies fed only cow's milk. Vitamin E. Increased risk for hemorrhagic stroke over there on the E toxicity side. Dysphagia, dementia, that end-stage vitamin E deficiency can cause heart failure with too much vitamin E. Xerophthalmia over there in the deficiency of A, enhancing the immune response. E is going to be good for immune E response. Ground glass deficiency of vitamin C. Because it's like decreased bone density. It's actually recommended exclusively breastfeed for 6 months up to 2 years. As you added more stuff, toxicity down there. Truncal limb ataxia, can't gaze upward for that intermediate progressive for vitamin E deficiency. Carotene is benign. Teratogenic, vitamin A, teratogenic. Normal cause of preventable night blindness in children, vitamin A deficiency, vitamin toxicity, eye mud piles. So you'll see that metabolic anion gap acidosis. Reducing agents, C, easy bleeding, bruising when you have too much E. Cystic fibrosis at risk for our left and right, so our A's and E's. Due to subperi, I wonder if that's like, no, I would have put that in for C. Due to subperiosteal hemorrhage, pseudoparalysis for C right in the center there, hyperthyroid, at-risk group deficient. You got the scurvy. There are 3 forms of vitamin A. Retinol is going to be the predominant one. Immigrants from Southeast Asia and Sub-Saharan Africa at risk for vitamin A deficiency. Poor wound healing and bleeding. So yeah, scurvy is kind of like the name of this constellation of symptoms for a deficiency of C. So you have that poor wound healing and bleeding, defective dentin formation. So these bleeding gums. So you're going to have like a bleeding gum patient. That's going to be more of a C thing here. And then you have growth plate fractures, pseudoparalysis, all going to be part of scurvy. May reduce incidence of atherosclerosis. 5 daily servings of your pumpkins. Let's talk about iron containing, especially those in acute pediatric ingestions. Vitamin A, and that's it. So we'll have 3 more cards that show up in a bit. That's it for, that's just the first PowerPoint. I'm a little behind of where I'd like to be. All right, so what we'll do next is load up cards for the second PowerPoint. Yeah, not in a great spot. There's really nothing. Yeah, I have this entire PowerPoint on 1 page. So get out of here. What are you doing? So what we'll do is we'll go through this, see if we can add any context before we screenshot it, and we'll do the same thing. Alcoholics are especially at high risk with B1. Thiamine deficiency is known as berry and comes in 2 flavors. We have dry. This is more the demyelination neuro stuff. We have a triad for Wernicke syndrome, could turn into Korsakoff's. Wet berry is more of the cardiac stuff. Going over to B2, riboflavin. So this is where you get that night blindness as well, cataracts, chelosis, trapping fishes of the lips, intrauterine growth retardation. Kidneys just secrete excess B2 in the blood. So yeah, ADEC. So B is going to be all water soluble. So toxicities are probably almost non-existent here. This is all going to be deficiency stuff, right? That's really important to kind of make sure you don't get confused with that. B2, you want to make sure you take with food. That seems pretty important. B3 is going to be this niacin. It's going to be involved with tryptophan, ATP production. I feel like that's pretty important. High doses may result in the old niacin flush. We have some at-risk groups here. Diet high in the 3Ms, meal, meat, molasses, presentation, skin lesions in sun-exposed areas. I think that's going to be a big one. Dermatitis, diarrhea, dementia, that's going to be a question. So we need to know that is the triad. I like to do this in order of like top to bottom. So we'll start up top with the brain, dermatitis of like the skin, and then diarrhea down low. I think that makes more logical sense. All right, thickened skin, this kind of sticks out. You can give tryptophan and oral niacin. Now, B5 is a weird one. Producing intestinal bacteria, so deficiency is rare. Note in severely malnourished individuals in famines and wars. I think that's pretty important. Paresthesia's burning feet syndrome. Pyridoxine converted to active form. Is there a foot emoji? Nice. Let's light it on fire. There we go. Burning foot syndrome. Ridiculous. All right, so B6, pyridoxine converted to active form PLP, essential for production of GABA. Yeah, I think that's pretty important. All this stuff here. I don't know, we'll make that blue to stand out. Also involved in tryptophan metabolism, and thus a deficiency can present like pellagra. So you have this kind of connection between B3 and B6. Patients with hepatitis on TB meds can actually be used to treat. So yeah, so B6 can be used to treat isoniazid toxicity. So however, all right, hold on. B6 can be used to treat isoniazid toxicity. So if you're on isoniazid, it binds PLP. You give them B6, which is more PLP, which is going to treat the isoniazid. Okay, you got to kind of wrap your head around that. Tractable seizures. I think that's a big one here with pyridoxine. I think the big thing here is you get these bilateral paresthesias either from deficiency or excess. That's kind of like a unique thing. All right, biotin we get from intestinal flora. We get that from B5 as well. Prolonged antibiotic therapy, I think that's a big one. Diet high in raw egg whites, the old Rocky Balboa diet. Throw a little boxing glove on there. TPN is a big one. Tinea curse, aka jock itch, recurrent fungal infections. So some big things there. Folate deficiency leads to megaloblastic anemia, as does B12, right? Only elevated homocysteine. You get that MMA and homocysteine elevated on B12. Fever of unknown origin was mentioned like 3 times. So I think that's going to be a question. Neural tube defects. That is a big one there for folate. Folate excess can lead to an increased incidence in cancer. That stands out. Folate is given for methanol toxicity. Yeah, so kind of interesting. So this would be the anion gap and osmolar gap. You can give B9 to fix that. So that's a cause of metabolic anion gap acidosis. And then isoniazid, along with iron, is the I of mud piles. Methanol would be the M. So I is going to be anion gap. It's not going to be osmolar gap because that's methanol. And is it just ethanol? No, it's ethyl something. So that's pretty interesting that these are both treatments for metabolic anion gap acidosis. It's really fascinating. All right, so B12, originally called pernicious anemia, due to high fatality. Strict vegetarian diet can cause a B9. I have the leafy green because you get folate from vegetables, but B12 you do not get from vegetables. So you need to eat some meat or something. Neurodeficits are a big one, although we didn't really go into a lot of detail with that, but there you go. Proprioceptive loss. That's going to be something you'll see. All right. So that's going to be this one. I don't think I need to add anything else. Screenshot that. We'll knock this one out. It's not zooming out. Myself down here like an idiot. Just a little bit. All right. So again, we'll start with, and this is pretty easy. It's just 1, 2, 3 at the top. But then we go to 5, 6, 7. So we're going to you skip one before going to the next level, and then you skip another one. You skip 8. So you skip 4 and 8. That's actually kind of nice. I actually use the same colors for folate and cobalamin as I did for hematology way back in like September. Yeah, there was one where alcoholics was mentioned like 100 times. I think we get more into that in oh no, that was definitely this one. Demyelination for dry. Just to make sure we know which one is which. It's kind of a matrix inside of a matrix. Yeah, so Wernicke syndrome, we definitely want to know the triad for this. We'll say that it's ACE. Korsakoff's, just to make sure we know the name of what's down here. Permanent something. So that's pretty crazy, all from a B1 deficiency. I thought the chest pain over here was interesting because like you see that so much on vignettes saying like wet berry as a differential is pretty spicy just for chest pain. We'll throw that on there. Wide pulse pressure, I think, is interesting. That's pretty much it. We'll go to B2. Excess leads to what kind of urine? Yeah, this phototherapy I thought was interesting. That's listed somewhere else too. I forget where. I don't, whatever. I could have sworn that was listed somewhere else. Night blindness here, I think is going to be an interesting one. These oily rashes came up a lot. Chelosis is one. This one I think is pretty interesting. Take it with food. Tryptophan here. ATP production. Nervosa. I guess we'll toss in carcinoid syndrome. TB meds live up here. Whatever. Skin lesions in sun exposed areas. That's pretty interesting. Demyelination here up with B3. This is going to be important. We want to know pellagra lives up here along with its triad. This thickened, hyperpigmented skin. And then the fact that we give tryptophan for this for B3. All right, vitamin A, cholesterol. Yeah, famines and wars, I think are the big one. This burning feet syndrome, that's going to be big. Production of all these neurotransmitters and catecholamines, I think, is important for 1, 2, 3, skip 4. So for B6, this pyridoxine or whatever. Also knowing tryptophan is here, I think is interesting. So let's link those. Fish that can present like pellagra. Yeah, hepatocellular carcinoma, that seemed to be interesting. And on TB meds, intractable seizures for, again, 1, 2, 3, skip 4. So for B6, these bilateral paresthesias from either deficiency or excess. Okay, moving on to, what's this, 7? 1, 2, 3, 4, 5, 6, 7. This is biotin, prolonged antibiotics, I think is a big one there. A diet high in, that's going to be a big one there because it binds biotin. And I think this is interesting, the TPN, so like a feeding tube, the name of Jokic, I think I should know, and then recurrent fungal infections, which I'll get because of the mushroom. Deficiency leads to, I already kind of know that. I already kind of know that. This, I think, is interesting. Fever of unknown origin. Neural tube defects, 500% incidence. Neural tube defects. Yeah, it's interesting. That's important. Spontaneous abortions. Folate excess can lead to an increased incidence in cancer. Interesting. Folate is given for methanol toxicity. And we'll throw that in there, isoniazid. Lemon yellow skin. So we kind of have, oh no, that was the orange with vitamin A, right? And I already kind of know that. All right, that's not too bad. That's a pretty good one. I'm going to say 45 cards. 60. Oh my gosh. Okay. It's off quite a bit. Do we want to do the ones for D while we're here? I mean, not really. A lot of this, luckily, I know from like hypo and hypercalcemia. I might just read some of this stuff tomorrow. It's like running out of energy. You can only do so much, you know? I mean, maybe if I get energy when I get home, but I feel like I'm really not going to. All right, let's knock out these. Oh, did I put them in the wrong deck? Dang it. There we go, 1502. Change deck. We're going to throw them in that one. Now we have 60 here. Vitamin D, I already made cards for that. So I don't know. Why reinvent the wheel? It's a lot of cards, though. All right. We'll study this in a second. All right. Let's see if we can knock this out. 60 cards. It's 313. Let's finish by 3:30. Speed run. All right. B3 on the upper right here is going to be something which you see in B1 also. Oh, demyelination. We'll take that. B6 can actually be used to treat what toxicity? Isoniazid. Patients with hepatitis and hepatocellular carcinoma at risk groups for B6 deficiency. Korsakoff syndrome, chronic irreversible dementia, bilateral paresthesias from either deficiency or excess of B6, which is called pyridoxine. Oral niacin, we're going to throw some tryptophan in there for niacin deficiency. I think that's important. Bottom left is going to be B9 folic acid or folate. Korsakoff syndromes, that worse one, Wernicke syndrome. All right, one of them is eye changes like nystagmus. I think A is ataxia, C is confusion. Let's go, baby. All right. Tinea curis? Curis, we'll take that. Presentation, skin lesions in sun-exposed areas for niacin deficiency. Totally could be a question. Alcoholics, huge buzzword for thiamine deficiencies. I think most of this, but B1 is probably the most serious, I think, because of this brain damage. All right, presentation, recurrent fungal infections over there with biotin. So just picture Rocky with some minging fungus in his jock itch. All right, so what is this triad called? This is called pellagra. That's for a niacin deficiency. You can also sort of get that with B6. So it's probably really important to look at the differences between those. Wet berry, yeah, chest pain from that B1 deficiency. Niacin is responsible for ATP production. Yeah, I was trying to see if there's any like fatigue with the presentation of that. It doesn't look like that. Pretty interesting, right? Blank defects, B9 folate. Yeah, neural tube defects. That's a huge one there. That's why B9 is a one of the big prenatal vitamins. Dry berry, present host neurologic symptoms due to demyelination. So we're going to see that in B1, and we're going to see that in B3 as well. B1 specifically with the dry berry side. Okay, take vitamin B2 with food. That's not niacin. What's B2 called? Thiamine? Riboflavin. Whoops. Maternal deficiency manifestations, intrauterine growth retardation for riboflavin. Yeah, so I assume that's going to be a prenatal vitamin also. Dry berry. So just got to remember the order of those. So DW. So it's just alphabetical. This is B12 cobalamin. Diet high in what is going to reduce your niacin? Oh, that's interesting. I don't know, actually. Oh, cornmeal, meat, and molasses. Sure. Blisters and vesicles in dorsal hands and feet. Oh, you're going to like thickened hyperpigmented skin? Yeah, it's going to be with niacin. You're going to get chelosis with riboflavin, although I think you get that with B9 and B12 as well, but we'll see that with B2, which is riboflavin. Intractable seizures with a B6 deficiency. I think you get that with isoniazid toxicity also. Eye, sun, and intractable seizures. Yeah, that's interesting. Weird link there. Too much, but then we can use it for, oh, but the presentation is of a deficiency. Deficiency B6 seizures. Too much isoniazid. Oh, so the seizures have to do with PLP. Because if you give somebody isoniazid, it's going to bind PLP. Oh, so PLP prevents seizures. So if you have not enough B6, you're going to lose your PLP, intractable seizure. If you're going to be on isoniazid, too much of that, it's going to bind to PLP, intractable seizure. There you go. Oh, I didn't even read that. B3 is called what? Niacin or nicotinic acid. Pellagra, what is the triad? So dementia, dermatitis, diarrhea. Perfect. Permanent brain damage with Korsakoff's. That's dry berry, B1 deficiency or thiamine. You're going to get yellow skin pallor with B12. I didn't know that. Again, these are deficiencies unless noted otherwise. B3 is synthesized from tryptophan. That's important. You're also going to see that with B6, right? Patients with HIV, this carcinoid syndrome, you're going to lose tryptophan, so you're not going to be able to make B3. A strict vegetarian diet for years can cause that B12. 1, 2, 3, skip 4. So this is B5, which is called panto something acid, pantothenic acid. Wet berry is going to be, I want to say vasodilation. Okay. Yeah. Interesting. So not vasoconstriction chest pain. It's vasodilation chest pain. That's pretty interesting, actually. B6, this is a fish you could present like pellagra. So let's see, what are the differences here? So presentation, yeah, I mean, you're gonna have seizures, you're gonna have skin stuff with both, but I think the seizures are gonna be the big one. You still get dementia, ataxia, impaired vibratory sense, and weakness is gonna point you probably more towards B6. They look pretty interesting. The anemia kind of stands out as well for B6. All right, biotin, a diet high in what eggs, raw egg whites specifically. TPN is going to be a risk group for B7. This is going to be wet berry, the cardiac one. Burning feet syndrome, going the B5 pantothenic acid. I don't know. You pull up your pants to look at your burning feet. So B5, and you have 5 toes. Oh, that's beautiful. 5 toes, burning feet syndrome, B5, pants. All right, this is B7 or biotin. Folate is given for what toxicity? It's in the metabolic anion gap realm, methanol, I believe. Proprioceptive loss. Yeah, you're going to see that stuff with B12. Bilateral paresthesias with pyridoxine. Yeah, so that is another actual presentation from too much isoniazid, which is going to knock out your PLP. That's pretty crazy, actually. That makes a lot of sense. So that's why isoniazid is gonna do that. It's all about PLP, I would assume. Pyridoxine converted to active form PLP, essential for production of what? I don't know here. Oh, yeah. So this is all your big neurotransmitter stuff. So it makes sense why you get these seizures and these bilateral paresthesias. So PLP, because you're losing all this neurotransmitter activity. Folate blank can lead to an increased incidence in cancer. Excess, actually, that's pretty important. We'll mark that as hard. At-risk groups, prolonged antibiotic therapy for biotin. That's going to be big there because they nuke your gut flora. I assume B5, you might get that too, but we'll keep that more in the B7 area. Wide pulse pressure greater than 60 between systolic and diastolic. It's going to be big for your wet berry. Noted in severely malnourished individuals in what? War and famine. So we're going to keep that in the B5. Night blindness with B2. TB meds are going to be the big one with pyridoxine. We already know why. Pregnancy alcoholics and what for phototherapy? I guess people, I don't really know much about that. Excess leads to bright yellow urine. Just looked at it. Oily, scaly rashes are going to be for riboflavin B2 deficiencies. Fever of unknown origin is going to be a big one for folate. So I don't know, look for that in a vignette. Memory loss, personality changes. So you can get neurodeficits without the anemia of B12. Okay. B1 or thiamine. Diet high in what for niacin? Oh, we just looked at this. Oh, this is the 3 M's. Meal, meat. What else did they eat back in the 1400s? Meal, meat, and maize is already. Oh, why don't they just do maize for cornmeal? Oh, molasses. We'll take that. At-risk groups. Anorexia nervosa is going to be at risk for niacin deficiency. Pyridoxine converted active production of, yeah, so catecholamines, which are your epinephrine, norepinephrine, and then GABA as well. Is like dopamine or serotonin? Is dopamine there? Yeah, probably. Neurotransmitters. Chronic irreversible dementia with that Korsakov's, hepatitis, hepatocellular carcinoma with B6. Black tongue, skin lesions in exposed areas. What else would you see in B1 that you're going to see here? Oh, demyelination. All right, we've seen all our cards. Folate. Let's speed run. We got 7 minutes. Korsakoff syndrome, Wernicke syndrome. All right, so eye changes like nystagmus, ataxia, and confusion. Gaze paralysis is there too. Chest pain with wet beriberi, bilateral paresthesias, either from deficiency or excess for that B6. Folate excess can lead to increased incidence in cancer. Niacin is responsible for ATP production. Pyridoxine, which is 1, 2, 3, skip 4, B6. Black tongue, skin lesions in photo or sun exposed areas. Chelosis, chapping and fissures of lips. B2 is also going to be known as riboflavin. B7, recurrent fungal infection. So we'll keep that with Rocky, right? I like this idea of attaching a character or a person to these boxes. I think I'm going to start experimenting with that. B6 can actually, because you could say, hey, Rocky ate eggs. He exercises 7 days a week, so that's B7. He takes his eggs out of a tin or a jar or something. So buy a tin, buy 7. He's getting this jock itch because he's a jock, and he gets these fungal infections. And I don't know, maybe he takes TPN because he doesn't have time to eat. You could throw a lot of that in there. And he was in the hospital for something, and he got antibiotics. B6 can actually be used to treat, think about this, isoniazid toxicity, intractable seizures for a B6 deficiency. Yeah, because you don't have enough PLP. PLP is good. If you get rid of PLP, you're going to get those seizures. Symptoms, demyelination for dry. Oh, D for dry, D for demyelination. There you go. And you could think wet for wide pulse pressure for the wet beriberi of the B1 thiamine deficiency. All right, so try it here is pellagra of B3, dry beriberi, tryptophan supplementation. Most cases, alcoholics is going to be the big one here for B1, specifically for dry beriberi. Tinea cruris for B7, B3, also known as niacin or nicotinic acid. Take B2 with food. Without anemia, skin pallor, bright yellow down there with B12. You're going to have this intrauterine growth retardation with B2 deficiency. Neural tube defects with B9, B12, cobalamin, a strict vegetarian diet can cause that. What's the skin issue with niacin? It's going to be hyperpigmented and thickened. Symptoms to vasodilation there. Pellagra is going to be dementia, dermatitis, and diarrhea. And W wet beriberi. This is B7 biotin. Burning feet syndrome, go with B5. And yeah, connect that with the famines and wars. TB meds, they're at risk for B6 because they're going to nuke your PLP. Or I guess it just nukes your B6, which then gets rid of your PLP. Loss. What kind of proprioceptive of B12, B3, also synthesized from tryptophan. B6 and B3 are related. 3 times 2 is 6. I like it. A diet high in raw egg whites. Patients with HIV or carcinoid syndrome, because it's going to nuke your tryptophan. Korsakoff syndrome, permanent brain damage, and dementia. Yeah, pretty crazy there. Folate is given for what toxicity? Methanol. B1 is also known as thiamine. Biotin, you get at-risk groups TPN. At-risk groups for B3 is going to be anorexia nervosa. Presentation, oily, scaly rashes. Excess leads to bright yellow urine with riboflavin. That's why I made it yellow. Skip 4, 5. This is going to be B5 or Pantothenic acid. Okay. Pregnancy alcoholics, phototherapy for hyperbilirubinemia. It's going to be at-risk for B2. Bilateral paresthesias from either deficiency or excess of B6, which is pyridoxine. Night blindness from B2. That's pretty important. That's you're gonna get that from an A deficiency also. So A and B2 noted in severely malnourished individuals in famines and wars. You got to wear pants if you're going to be in a war, right? Neurodeficits can appear without anemia for B12. All right, six more. It's 328. Let's go. Prolonged antibiotic therapy, unknown fever of unknown origin for B9, folate, essential for production of, GABA, catecholamines, neurotransmitters, wide pulse pressure for wet berry. Yep. Diet high in, molasses, cornmeal, and let's see, meat. Okay. Folate excess can cause that increased incidence in cancer. There it is. Oh man, 329. That was beautiful. Let's hit these reviews real quick for the first one. Just vitamin C, male infertility for A, and cholestatic liver disease for E. Yeah, so we'll hit all of these again tomorrow morning before the exam. Essentially, you would want like a third day in there, but we'll hit those. I don't know that I have the energy to start vitamin D right now. I guess we should. Let's just do it. We're just gonna go right into it here. This is the worst. All right. Let's have some fun. Caucasian children need about blank hours a week in the sun. Isn't it like 1 to 2? Let's go. All right, rickets, vitamin D, calcium deficiency in children. So rickets specifically for children before the blank fusion, like epiphyseal plate. Softening of bone is osteomalacia. Serum blank levels best indicator of vitamin D status. Just 25 OH if they have normal renal function. Physiologic cause of deficiency, medication ketoconazole. So this is deficiency of vitamin D. Glucocorticoids are going to do that. Routine screening for vitamin D deficiency for all is not recommended. Treatment in renal patients, GFR less than 30. 125 OH, what's the name of the med? Just calcitriol? Second, hydroxylation, which occurs in that's going to be the kidney, the proximal tubule, I think. Treatment for patients with mild, moderate deficiency, 12 to 20. I think this is 1,000 to 2,000 daily. For patients with severe deficiency, you're going to give them 50,000 weekly for 6 to 12 weeks. So there's two 12s here. There's the less than 12 as your threshold, and then 6 to 12 weeks with 50K. It's crazy. Serum 125 OH, only measured in patients with, like renal disease, end-stage renal disease, typically those with a GFR less than 30, I would say. 88-year-old. Okay, so this is a whole vignette. Oh, geez. GFR 15. I'm just going 125 here. Yep. Good. Okay. Liver. So we're going to have just like our standard D3, which is cholecalciferol, which turns into 25 OH in the liver. Kidney turns it to 125 OH. So what's hiding here should be 25 OH. There you go. Vitamin D main source is from sun exposure. Main function is to help regulate serum calcium, phosphorus as well. Vitamin D increases serum calcium and phosphorus. Her vitamin D 25 OH is 10. What treatment is indicated? Yeah, so that's less than the threshold of 12. So 50K for 6 to 12 weeks weekly. Good. I'm flying through these. All breastfed infants should receive vitamin D. How many IU per day starting by 2 months? 500, 400. Come on. Blank OH is a mature active hormone of vitamin D, 125 OH. Decreased bone mass osteoporosis, evaluated with a DEXA scan, which gives you a T-score. Vitamin D action, high affinity for action so this is BIC, so intestine, bone, kidney, and this is going to be intestine, stimulates intestinal transport of calcium and phosphorus, right? So it's going to increase the absorption of both of those, right? Physiologic cause of deficiency, decreased production, normally decreases with age. Yeah, so your dietary intake and your like sun and just general skin production go down with age. That's going to be 125 OH. Risk factors for vitamin D deficiency, like darkened skin. UVB is going to be the one that gives you that cholecalciferol, accelerated loss of vitamin D, medication barbiturates, what? Oh, another med. Oh, phenytoin. Yeah, that's messes a lot of things up. Treatment in renal patient, treat calcitriol and monitor what levels? Probably they're 125. Oh, just calcium. Okay. Most studies recommend supplementing with blank since it has a longer half-life. Oh, D2 versus D3. I think D3, right? Calcitriol. Oh, that's cholecalciferol. We should know that that's not calcitriol. Calcitriol is 125. Blank rosary, delayed fusion. So this is what you see for rickets. It's rochitic or something? Yeah, rochitic. We'll take that. But know that that's for rickets. Granulomatous disease, lymphoma, Williams syndrome are contraindications to vitamin D. Yeah, that's pretty important. I do have some more cards there. Lymphoma. Physiologic causes of deficiency, impaired activation, hypoparathyroidism. I would think like liver failure or kidney failure. Yeah, we'll take that. Rickets leads to growth, retarded osteomalacia, and blank of weight-bearing bones. Osteoporosis? Bowing. Sure. Treatment for severe deficiency, 50K. Vitamin D increases serum calcium and what? Phosphorus. Breastfed infants should receive 400 a day starting by 6 months? 2 months. Come on. Decrease bone mass. Osteoporosis? Good. And that threshold is going to be greater than 2.6 below normal standard deviation. Hyphen interaction in the intestine, bone, and so it's BIC, so it's kidney, increases renal reabsorption. So that's where we get a lot of that phosphorus increase is the kidney. That's interesting. The calcium is going to come more in the intestines, right? Risk factors, vitamin D malabsorption. Fat malabsorption, because this is an ADEC. UVB for pre-vitamin D3, which is also known as cholecalciferol. Stay cool. Accelerated loss of vitamin D, medications, barbiturates, phenytoin, rifampin. So more TB meds here. Critic rosary, rickets, Williams syndrome. You do not want to give vitamin D. Yeah, so the Framingham offspring study, I don't know. It said vitamin D is good for reducing cardiovascular events. So if you have a deficiency, that's not good. Autosomal recessive disorders. We have pseudo vitamin D deficiency rickets. Problem with 1-alpha hydroxylase. Okay. Vitamin D receptors in most tissues, modulation of cell growth. In the liver, vitamin D is metabolized in major circuit form 25-OH. Oh, is there a name for this? Isn't it calcidiol? Let's go, baby. Treatment, less than 12. T-score. BIC, so bone, which is going to do what? Regulate osteoblasts, osteoclasts. So what does it do? If it increases your serum calcium, it's going to stop your osteoblasts, which are pulling calcium and building bones. It's going to stimulate your osteoclasts, which are pulling bone and throwing calcium into the blood. Breastfed infants, right? That's why we're giving 400 IU at 2 months. What is another name for cholecalciferol? D3. Same symptoms plus what? Vitamin D deficiency, rickets, anemia, alopecia. What is that again? Is that, oh, it's hair loss. So what's that? So this is two types of autosomal recessive disorders, pseudo vitamin D deficiency rickets or vitamin D deficiency rickets. And that's where you get alopecia. That's an issue with the receptor. It's more difficult to treat. Six to 12. Osteopenia is 1 to 2.5. I have the numbers there as well. I do for that one. Treat with calcitriol, right? That's our 125. It's good. It's the good stuff. Neuromuscular and blank function. I don't know. Nervous system, immune. Major circulating form, liver is 25 OH. Osteoporosis is greater than 2.6. So that's going to be an important number. So 126 is glucose, right? For glucose intolerance. Well, no, that's like 100 to 125 just for diabetes. So both, I don't know. They're both 26. Type 1 pseudo. So everything but alopecia. I think it was like seizures, growth retardation, reduction of free radicals, inflammation. Ah, okay. Autosomal recessive? 2 months. They love asking those questions. 400. D3, calcitriol. Cholecalciferol. I keep doing that. Vitamin D receptors in most tissues, neuromuscular and immune function. Reduction of inflammation. That's just like benefits of vitamin D. Cholecalciferol, D3. Glucocorticoids cause vitamin D deficiency. Only measure in patients with blank disease, typically renal GFR under 30. Weekly. 1 to 1,000 daily if you're in that 12 to 20 range. That's important. Liver is going to give us 25 OH. Routine screening for vitamin D deficiency for all is not recommended. Vitamin D main sources from sun. Her vitamin D is 10, so it's less than 12. It's going to be 50K weekly, 6 to 12. Softening bone osteomalacia. Caucasian children need about how many? 1 to 2. Vitamin D increases serum. I assume if you need darker skin, it's going to be more than that, maybe like 2 to 4. Vitamin D increases serum, calcium, epiphyseal, age, 125, DEXA scan, darker skin, northern latitudes is there. Rachitic rosary, this is going to be rickets, calcium, kidney, intestines, 125. In normal healthy patients with good renal function, it's going to be 25 OH. It's that main circulating volume. What's the name of 125? Calcitriol. Vitamin D. So lymphoma, Williams syndrome, granulomatous disease, what, like sarcoid? UVB is the one that we want. Medications, barbiturates, phenytoin is a big one there. Nephrotic, I saw nephrotic syndrome on there too. I guess it kind of makes sense. This is going to be 125 calcitriol and monitor calcium levels for the renal patients. So calcitriol, again, is that 125 OH. Vitamin D increases serum calcium and phosphorus. Williams syndrome, don't give vitamin D because they already have like bone issues. Vitamin D is going to increase calcium, so it's going to pull. Oh, a lot of this too, cancer's on there, which is pretty interesting. So metastatic bone cancer and lymphoma, which is going to be what, the cancer of your like white blood cells, which come from bone marrow, right? Interesting thing with this is that vitamin D is going to increase your calcium in 3 areas, right? Bone, intestine, kidney. Kidney's more of the phosphorus side of it. But if you think about how this works, it makes a lot of sense. It's going to stop your osteoblast. It's going to stimulate your osteoclast. So they're pulling parts of your bone and putting it into the blood. So they're pulling cancerous bone tissue, and it's going to spread in your blood. It's going to make the cancer spread more. So that's pretty crazy, but it totally makes sense. D3, another name for D3 is cholecalciferol. Stay cool. Evaluate DEXA scan, which gives you a T-score. Osteoporosis is going to be greater than 2.6 below normal, which I think it's like a negative 2.6 or something. Modulation of cell growth. High affinity fraction in the intestine. What's missing? So bone. Physiological cause of deficiency. Renal failure less than 30. Complications. The Framingham said not enough vitamin D is going to increase your risk of a CV event. Cardiovascular event. And Boeing this is part of rickets. This is what we see in children. Fat malabsorption, of course. Chytic rosary, long bones, indicative of just rickets, deficiency, severe 50K weekly breastfed infants. If they're specifically cow milk fed, this is in the center. This is going to be you're going to get a vitamin C deficiency there. Previtamin, this is D3. Hydroxylase. Major circulant. What's another name for 25-OH? Calcidiol. You're going to get alopecia when? In the non-pseudo vitamin D deficiency rickets. Rifampin is going to kill your vitamin D through accelerated loss. High affinity fraction in the intestine, bone, and kidneys. That's where we're going to get that phosphorus increase. 12 more cards. Let's go. Weekly for how many weeks? 6 to 12. Less than 12. Recessive, neuromuscular, and what function? Immune function, autosomal recessive. That's that pseudo. It's that first one. So important to know here, typical diagnosis in the first year of life. You're going to get hypocalcemia. You're going to get growth retardation. Hypocalcemia makes sense, right? If not enough vitamin D, seizures, rickets, which I think rickets normally happens in like the first year anyway, right? Osteopenia, think about this for a second. Yep, is 1 to 2.5 below. Most studies recommend supplementing with just like D2 versus D3 in general. So when we're not talking about calcitriol for renal patients, yeah, it's like 50,000 IU of what? Is it calcitriol or is it I think it is. I don't think it's 125. This is D3, so this is cholecalciferol. How do we treat probably just calcitriol? Think about that. What is calcitriol? It is calcitriol. So we're giving them 125. That's pretty important. The different treatments here. All breastfed infants should receive vitamin D. See, this doesn't say what type of vitamin D we're giving them. I assume this is, I actually don't know what this is, but it's 2 months, 400 IU. Liver is 25, greater than 2.6 for osteoporosis threshold, reduction of inflammation. That was like 60 cards in 60 minutes. That's pretty good. I did 385 cards today. Look at spring break here. Haven't done Anki since Friday, March 1st. What? I don't even know. What was I studying there? Oh, I think that was an anatomy practical. So I do have some notes for vitamin D. I did the Feynman technique here. So I could potentially add in some more Anki with this, or maybe just read it tomorrow. See a lot of what we just talked about. So calcitriol is what again? That's through 125. So that's the treatment of this part of rickets here. See, osteomyelitis says vitamin D. Like it doesn't, I assume that's cholecalciferol there. Like unless mentioned otherwise. Even this, okay, so I think all of this, except for renal patients, calcitriol. Yeah, because remember, this is 125 OH. Everything else is going to be most likely D3, I would assume. That is a really important distinction to make. I am risking it by just assuming that. I don't think you would want to give them, but yeah, I don't think you would want to give them calcitriol. I also don't think you would want to give them um, uh, calcidiol, which would be 25 OH, right? You just want to give them the precursor, let their liver do its job, let their kidney do its job. That makes the most sense. It's like one of those things you memorize these so much, these numbers, but then you forget to like take it one step further. And that's always frustrating when you know there's something that they're going to ask, but you're focusing on the wrong part of it and you feel so stupid. That's it. I'm going to finish doing cirrhosis, hematemesis. I'm going through some matrixing for this. I'm about more than halfway done. That's it. That should be it for this exam. So that's it. I'll see you in the next one.